There's a difference between learning iridology and learning iridology at a clinical level. You see, many iridology instructors focus primarily on the iris map and individual markings. They teach markings as separate pieces, lesions or lacunae, colors, pigment, each interpreted independently of the bigger picture. Too often the message becomes, this marking means that condition. Thus, a lacuna automatically means an active issue, even without corroborating symptoms or broader context. It becomes a one-to-one correlation, almost like a paint-by-numbers project, with conclusions delivered as fixed pronouncements. But learning iridology at a clinical level is different. Clinical iridology teaches you how to integrate markings, patterns, constitutional tendencies, and client history to uncover the most relevant questions to ask and to gain a deeper understanding of the root and progression of health concerns. For example, someone trained only in one-to-one correlations might look exclusively at the osseous zone when assessing a client with gout, searching for an isolated aberrant marking. But when I train clinical iridologists, I teach them to look much deeper. First, are there iris indications of kidney predispositions, genetic or epigenetic, since the kidneys play a central role in regulating the uric acid balance in the blood? These indicators could include pigments, lacunae, or fibers that seem to be out of place. Then we'll examine the stomach reaction field to see whether markings there suggest an inherent predisposition toward poor protein digestion, which can place additional stress on the kidneys and contribute to gout tendencies. We'll also assess the small intestine reaction field for indications of inefficiency, which could affect the breakdown, release, or absorption of purines and further aggravate gout patterns. This depth allows us to ask more probing questions and find and address the roots of the issue. That's the difference between memorizing markings and understanding the physiology and constitutional patterns behind them. So, if learning iridology at a clinical level is something you're considering, and you already have a college-level anatomy and physiology class to your credit, reach out to me. Let's talk about iridology and whether adding it to your skill set is the best next step for you.